Track 4. Where it all starts, the role of the foot in arthritis. Although, as I've mentioned earlier, there are many types of arthritis, osteoarthritis is something we're all told we'll get as we get older, without much chance of preventing the seemingly inevitable. We're led to believe that it's simply part of the turf, part of the price we pay for living longer. And although supplements like glucosamine and chondroitin sulfate are things that can help, a great deal of emphasis is put on decreasing excessive weight. And why? Because we know that excessive weight causes more friction on our joints and therefore wears them out. Clearly, research has shown that increased stress on our joints, like that caused by excessive weight, causes more damage to those joints. As a matter of fact, overuse, that's right, overuse, even without injury, is the main cause of osteoarthritis. So now let me ask you, since that's true, doesn't it make sense too that poor alignment can and does increase that joint stress? Yet remarkable as it may sound, information from the most prestigious organizations for arthritis, such as the Arthritis Foundation and the National Institute of Health, does not even mention the word structure. That's right, you heard me correctly. The word structure is not even mentioned. And the effect of structure on arthritis is never even discussed. So I guess if you have arthritis, you're supposed to just lose weight, take your supplements, and then replace the joints when they wear out. Doesn't make much sense to me, does it to you? But think about this. You know that if you drive a car 50,000 miles, your tires will probably get bald, worn out. Your tire tread will be gone. But you probably also know that you can get far more wear on your tires by driving them 10,000 miles in poor alignment. Most likely, you're also aware of the fact that if you rub two rocks together over a long enough period of time, they too will wear away at the point of maximum friction. Why, even water running over a rock long enough can wear it away. Yes, indeed, friction destroys surfaces. That is a fact as sure as the fact that we'll all pay taxes next year. And these well-known facts regarding the destructive force of friction on a wide variety of surfaces also most certainly applies to our joints. Take a moment if you can and stand up now. While keeping the inside of your right foot on the ground, roll your right foot inward by lifting the outside of your foot so that your right knee is now closer to your left knee. Now walk around the room for a little while on the inside edge of your right foot. That's right, you got it. Walk for a minute on the inside edge of your right foot while keeping your left foot flat on the ground. I'll bet you feel like a cripple already, don't you? And it certainly wouldn't take long for you to get some discomfort on the inside of your right knee. Now imagine that, as I mentioned before, that in your average lifetime you will have walked over 4 times around the surface of the earth with 900,000 billion pounds of pressure on your feet. And you can just begin to get some idea of what you would do to that right knee. Is it any wonder that since most people do in fact have a foot that pronates or rolls in like that nearly 500,000 total knee replacements have been done each year, mainly for arthritis and not injuries? And as a former reconstructive surgeon, I can tell you most assuredly that the damage to the joint cartilage seen from walking like this would be indistinguishable from that caused by osteoarthritis. Yet when arthritis occurs, we are simply told it's old age. Ridiculous! Just as ridiculous as when I see a patient whose right knee hurts and because there is no history of an injury, they think the reason for their pain is the fact that they are 72 years old and have played tennis most of their life. Of course, my response is your left knee younger than your right knee? Or did you just leave your left knee home when you played tennis? Structure, yes, abnormal structure, will destroy joint cartilage and cause arthritis as sure as poor wheel alignment will ruin a car's tires. And unless we are skeletally aligned by controlling our structural core, that important subtalar joint I told you about, you are just putting more air in a leaking tire. And to make matters worse, we're also told how important it is to exercise with arthritis, that the movement of those painful joints is critically important. As a matter of fact, studies show that among adults with knee arthritis, engaging in moderate physical activity at least 3 times a week can reduce the risk of disability in those with arthritis by a whopping 47%. But just how are you supposed to keep active if walking abnormally has contributed or caused your problem to begin with? Doesn't make much sense, does it? And that's exactly why I often say, health is something you can go through on the way to fitness. Let's be clear here. While weight loss is important, it cannot fix abnormal structure. and abnormal structure is usually a component of arthritis of the weight-bearing joints.